Right, so this is my video for my teaching learning quiz. I just wanted to show you a few resources and some things that you might be able to use as a nurse and educator regarding cancer prevention, protection, treatment, anything like that. So I'm just going to start on the Department of Public Health and Human Services homepage. From here, you're going to click on the Health tab, and then the Cancer tab. And this is kind of their main page with all of their cancer control programs, data, services, different medical providers in the area, the Montana Cancer Control Coalition page and plan, which I'll go into, and then the tumor registry, policies and procedures, and how to contact. So I met with a gal named Nikki who works for the Department of Public Health and Human Services specifically regarding the cancer control programs that they have. And so she kind of showed me some of these things. And so from here, I first want to talk about the cancer screening services. And people who are low income may be eligible for free or low cost screenings. They can call this number, or they can fill out the various forms here. And they're all pretty self-explanatory. So if you come across a patient who says, oh, I can't get screened because I don't have the money right now, maybe they're eligible for this. And so you just click on the Cancer Screening Services link, and then from here you'll go to the forms, and you also can click on the income guidelines here. And it just gives you income requirements for those discounted screenings. Next, I want to show you guys the Montana Comprehensive Cancer Control Plan, and that's just right here. And then right here. So this is through the Montana Cancer Coalition, and they create these 5-year plans. And so as you see, this one's ending this year, and there's a conference at the end of May that will be kind of head starting the next 5-year plan. So this is the current one, and I just wanted to show you guys their goals and then things that we could do as nurses regarding the treatment and prevention and protection of Montanans that might be dealing with cancer. So they have a lot of great information, resources, and things like that on here. I'm just going to scroll down to their goals. So their first goal is to support the work of prevention partners to reduce the impact of unhealthy lifestyles on cancer risk. So in these goals, and they have objectives and different strategies. So I'm going to focus on these strategies as what we can do as nurses. So we can promote the Montana Tobacco Quit line and other existing evidence-based resources to increase cessation attempts. So on intake, usually you're asking your patients, do you smoke, and would you like to quit? Would you like resources on quitting? So making sure that we do that and follow through with that is really important, I think. They want to reduce the exposure to secondhand smoke. There's different things we can do, like advocating for the continued protection of the Montana Clean Indoor Air Act. And you can just go through and review these strategies, but I'm just going to focus on a few of them. So a lot of increased cancer risk has to do with poor nutrition and obesity, and so one of the other strategies I wanted to focus on was to utilize community events, media campaigns, anything like that to encourage nutrition and physical activity among Montana residents. Their second goal is to promote cancer risk reducing behaviors through evidence-based education and advocacy. So this is just again, informing, educating, partnering with different groups to promote, risky behaviors. And the one I wanted to focus on here was utilize community media campaigns to discourage youth from using artificial tanning facilities. There's a statistic that 1 in 3 high schoolers artificially tans, and that's a big population. And so I feel like any sort of education we can do regarding that is really important. Let's see what else. Again, just working with other schools, organizations, things like that for prevention, awareness, different things to look for. Another goal in their screening and early detection part is to promote compliance with cancer screening guidelines. So, a lot of people are just unaware of when they should be getting screened for different cancers, and so we want to just promote those nationally recognized guidelines to the healthcare providers we're working with, to the public, to our patients, anyone that we come across. So, it's really important to kind of know those ages and know those guidelines. Again, just their objective right here is to reduce the number of people over age 50 who report they were unaware that they need a breast or colorectal cancer screening. So again, it's just awareness, implementing media, news, radio, anything like that, getting people aware that they need to be screened. So here's our second goal under this. It's broaden the use of low and no cost cancer screening services. So that's what I showed you at first, getting people access to those forms and eligibility requirements if they're low income, if they can't feel like they can afford screening, getting them access to those so that they can be screened. So with that, we need to educate healthcare providers, their staff, and our patients that may be eligible for this type of low and no cost cancer screening. And I then wanted to look at, under their treatment and research, ensuring high quality cancer research in Montana. So again, if you're interested in legislation or public health or anything like that, monitoring policy changes, monitoring legislation that will promote clinical trials, funding for research, anything like that, it's really important to get behind that if that's something you're passionate about. And then goal 2 is to ensure prevailing standards of care for all cancer patients in Montana. So again, this is just working with different physicians, groups, and things like that to support these programs that are really important for cancer prevention and treatment. All right, and there's just some really good resources and ideas on here about things we can do. Providing them with access to cancer treatment and research information. The Department of Public Health and Human Services has data and statistics and things like that regarding treatment and research. So the rest of this is just about quality of life, survivorship, things that we can do. But I just wanted to focus on the other things about awareness and screenings and things like that. So now you can follow the link that's after this video to see the various ages that are that different screenings should be done, and then you should be able to answer the questions based on that. All right, thanks.